you so much for having me. I love having the opportunity to talk about what I do and to talk to students especially. As Mo said, my name's Linda Franks. I started with Kid Healthy in 2011. Prior to that, I was the Southern California Director of Public Relations and Marketing for Nordstrom Incorporated. You would ask the question, or I asked myself that question, how did I get here when I was a PR major in communications from Cal State Fullerton with my bachelor's from Cal State Fullerton in communications. I never thought I would end up in the health arena. But one of the things that I love to talk to students about is as you're planning your career and your next steps after you leave this fine institution, be open-minded and look at what your talents are in different arenas, and there's a lot of opportunities out there. So enough about me. Oh, I'm married. I have 3 girls, all 2 graduated college already, and 1 that's a freshman currently, and a dog named Remy. I'm a very casual person, so I like to walk around. Feel free to ask questions as we go along. So I'm from Kid Healthy. Kid Healthy is a nonprofit organization that was founded in 2003 by a friend of mine named Jackie Teichman, who was not necessarily a health professional either, but had a very personal interest in the what was happening with diabetes at the time. She had a granddaughter who was afflicted with the disease, and she was a big philanthropist who was used to raising money, and that was how I met her. She used to chair some events that we did at Nordstrom, and we became friends. She started working professionally for Children's Hospital Orange County and founded the Padres program there, which is a pediatric adolescent diabetes program that she brought to hundreds of schools, not only in California, but it spread nationally. So when she was feeling like she was kind of finished with her work there or needed something new, she founded, along with a friend of hers named Teresa Samaniego, who is the Vice President of Public Affairs at ABC7, together they were able to get some funding to tackle the diabetes issue a little broader. So she got funding to launch our first program, which was called Steps to Healthy Living. You're probably too young to have heard about it at the time, where there was a number of PSAs that were running on ABC7, and it was basically a classroom-based program that ran in hundreds of elementary schools from northern LA to San Diego. We reached about 95,000 students each year, and what it was a classroom-based learning opportunity for students to understand the importance of increased fresh fruits and vegetable intake daily and increasing your steps daily. They had a little chart, and they were asked to track, what am I eating every day? And they had little stickers to put on this diagram, and how many steps am I taking every day? And steps can be actual, thoughtful walking. It can be playing a soccer game. It could be riding a bike, riding your skateboard. So they were challenged to think beyond what, traditional thoughts of physical activity were, with the intention that over this 3-week time period, they would develop the habit of being conscious of fresh fruits and vegetable intake and physical activity. So that was run successfully for about 10 years. It was funded by the California Department of Public Health, Children's Power Play campaign. And then in about 2012, right when I came on board, the funding was cut, unfortunately. So what we did at that time is took the concepts of that program and developed a deeper interaction, pulling in parents to be the leaders behind the thought. So that was how Padres in Action came to being. In 2009, we were sitting on one of the first district wellness councils in Santa Ana Unified. They invited us to be a member on that group, and some parents were talking about their frustrations where there wasn't enough physical activity in schools. So they started a volunteer group. It was about 8 parents in Santa Ana Unified, some of the lower level income schools, and they started volunteering on the playground. When I came on board, it was kind of hit and miss. I would show up and there'd be 5 parents there one day. I would show up another day and there'd be no one. So I took that concept, got some funding, and was able to actually hire a parent from among that group of volunteers. So we started paying the parent a stipend to work 6 to 8 hours a week. That person became responsible for parent recruitment, marketing the program, managing the playground equipment. We got enough money to buy some extra equipment, and it became a little more structured. And from there, it just grew and grew, which we'll talk about in a second. So we're currently at 42 school sites. When I came on board, we were at 4 with all volunteer parents. We're now at 42 school sites in 6 school districts in Orange County. We did do a test launch in LA last year that was successful, but they couldn't keep the funding going. So we're working on trying to get that back again in LA. We were at LaSalle Elementary and 61st Street Elementary, which is in one of the more challenged communities in LA and Southeast LA. Our second program is Cooking Up Change. That's a national program that was founded by Healthy Schools Campaign, which is a health and wellness organization that's quite large, based out of Chicago. They started a cooking challenge amongst high school students with the premise of engaging students in the whole lunchroom concept. Who manages school lunches? Who makes the rules? How do I make school lunches taste better? So it's a 6-month-long program. We liked the concept. We thought it fit within our objectives of Kid Healthy, and we brought the program. We started a regional contest here in Orange County. In 2012 was our first competition. We just had our 6th competition last Thursday. And we were the first organization to bring it to California. So I'll talk a little bit more about that as well. Okay, so why do we do this? There is a lot of data out there that you will see on obesity, health afflictions related to obesity. And I was just telling Mo, it varies depending on what report you look at, but it falls within a certain parameter of numbers. I like the opening to this UCLA report because this basically sums it up in a nutshell. Obesity is a complex condition that's influenced by neighborhood, environmental factors, behavior, genetics, culture, and socioeconomic status. But more importantly, the real basic of obesity is that it's an energy imbalance. Food in, exercise, calorie burn out. And you would think that that's an easy concept to tackle, right? Who thinks that should be easy? Has more weight on them right now than they want to have? I tell myself that every day, like, okay, I'm doing good, and then I eat that piece of pie. So this simple concept becomes really complex, and when you look at the amount of funding and energy and people like me who work in this industry, it's really, really difficult because changing behavioral habits has to be a personal decision, but more importantly, it has to be something that they're capable of doing in a non-complicated way. So we all work to figure that out. And we make successes, and then we have setbacks, and then we make successes. So it's an ongoing issue that is now we're more aware of the fact that this simple issue of a child growing up obese, living in an underserved neighborhood, starts to impact everybody, not just them, because we're paying more for health care. We're having issues of heart disease, diabetes, certain cancers that are all impacted by poor health. So, statistically, the impact in terms of where you live, your access to fresh fruits and vegetables that are affordable, and your access to open spaces to play and get physical activity impact your health. So you look at the numbers here of 31% of adult Californians with incomes below 200% of the federal poverty level, which again, this number changes too. I was fine-tuning this PowerPoint last night, and then last Friday, and then there was a story this morning, I don't know if anyone saw it, that if you live in San Francisco, the poverty level is presumed to be $100,000. I'm like, wait, what? I mean, I didn't get into that, and I'll probably look at that more closely, but the standard is $24,000 a year for a family of 5. Now, who can live on $24,000 a year with 4 kids in Orange County? No one I know. So that's where we have to deal with some of these issues that are circular in effect. So the prevalence of obesity is also higher among different cultures. So African Americans, American Indians, and Latinas have a higher percentage. Now, why that is it because they're typically in more higher poverty neighborhoods? Is it because they're not as educated? You know, all of those factors come into it. So what we did when we started Padres in Action, we were already in Santa Ana, so we started there. Santa Ana is one of the higher percentages of obesity statistics in Orange County. Santa Ana is number 2. Stanton is number 1. Can anyone tell me what that percentage is in Stanton or Santa Ana? What would your guess be? What percentage of the population is considered obese? Anyone want to guess? I didn't hear. 70%? No, thankfully, no. In Stanton, it's 51.8%, and in Santa Ana, it's 46.5%. So about half the population is considered overweight or obese. So in comes Padres in Action. We took those same concepts of increased fresh fruits and vegetables daily and increasing the physical activity, and we listened to that small group of parents who were saying, there's a problem here. We want to increase physical activity opportunities within the school site. And we put them, like I said, we started them off as all volunteers, and we've structured it more effectively as we've gone along. So what is Padres in Action? Padres in Action is a parent training program that empowers parents to be school leaders in health and wellness. So what we do is we teach them, what is wellness policy? Did you even know that your school and school district has a wellness policy? We read it to them, we give them a copy, and we teach them what the purpose of that tool is. We teach them advocacy from the very basics. What does advocacy mean? What does advocacy mean?
Not all at once.
Yes, affecting change. And for this group of parents who often are uneducated, it's a simple ask. I'm asking for something that's important to me. And then we teach them who are those folks that they need to become friends with and ask and be comfortable enough to ask. And then, of course, the biggest outcome work that we do is the actual physical activity. These parents are then taught how to go out onto the playground, interact with a student, because students are milling around. Some of them are open to playing. Some of them know how to play, and they're the expert, and they don't need you. But most importantly is we take a look at the playground. What are they doing? What are they not doing? We offer games. We buy some equipment, we bring it out there, and we teach the parents how to set up a station and how to get a large group of kids playing. And not just playing, but getting their heart rate going and really using that 20-25 minutes they have very effectively. So we teach them how to be safe, how to make sure no one gets hurt, and how to be super nice and encouraging. Wait, you? It's okay. Okay, so what we do is we start off at a school, we recruit a group of 30 to 50 parents. It usually averages overall about 25 to 30 parents. We do have a couple of Cowabunga schools who have like 50 to 60 parents who go through the training class. It's a series of 6 classes where we go through as comprehensively as we can in 2-hour sessions, the topics that I discussed previous. And then while we're doing that over the 6-class structure, we usually do 2 classes per week, so it takes 3 weeks. And it's usually like a Tuesday, Thursday in the morning. So the parents drop off their kids, they come into a classroom, we serve coffee and healthy breakfast items, and conduct the classes. It's very casual. The intention is for this parent group to bond, to meet other parents who have the same interests, and to learn something helpful to them. And while we're doing these classes, we're looking amongst this parent group, who's talking the most, who really seems like they get it and have kind of a passion for it, and we hire that parent. Now, it's not always easy to find that parent. Some really stand out and really want to do it, and some are afraid. They've never gone to school, they've never spoken in front of a group of parents. Oftentimes they have a family situation where it's just not good for them to be out of the house or take on that kind of leadership. But 9 times out of 10, we find a parent, we give them a small hourly stipend, and they work about 6 to 8 hours a week, and their primary responsibility is to keep that group going and build that group. Because we don't want just the parents who went to that class. We want those parents to now be peer educators, to get other parents involved and keep the group going through the whole year. So this group now goes out onto the playground every Monday, Wednesday, Friday, and leads physical activity. In addition to that, and what we find is oftentimes parents, especially in some of the schools that we work with, they're looking for a reason to come and get involved at school. They're not really comfortable. They don't really have a place. Oftentimes teachers don't really want you in the classroom, so they'll join PTA or they'll get involved in some of these other parent groups, but this gives them an open, comfortable place for them to come on campus and get involved. So far it's worked out really well. Okay. Okay, so why is parent engagement important? You'll find lots of studies out there that tell you all the data on parent engagement, whether you're in a high socioeconomic community or a low socioeconomic community. Parent engagement is key for a number of reasons. It impacts your students. Wait, before I jump ahead of myself. Evidence. One of the experts, Henderson and Burla, the most accurate predictor of a student's achievement in school is not income and social status, but the extent to which the student's parent and family is able to create a home environment that encourages learning, and when parents express a reasonable, realistic expectation of their children, the children is most likely going to meet that expectation. And when parents become involved in their children's education at school and in the community, they develop as well. Okay, so the benefits for children, we talk about that a little bit, and I won't read this whole thing, but they achieve more, they get better grades, they get higher test scores, they consistently complete their homework, they're showing up to school on time. They have a better attitude when their parent is a positive, engaged individual in their life. Fewer children get placed in special ed and remedial classes. And children from diverse cultural backgrounds tend to do better when parents and professionals work together. So the parent's not just working with the students, they're engaged in the school environment and getting involved in policy and the environment of the school itself. Okay. Oh, and students, as they progress through or matriculate through junior high and high school, are more likely to seek a higher education as well and not drop out of school. The benefit to parents. Parents increase their interaction and discussion. It opens up conversation with their students. One of the classes we teach, which people don't really, as a parent, you don't really stop and think about, but one of the most important opportunities that a parent has to interact with their child is, who can guess? What time and event that you do every day is one of the most important with your child? Driving to and from school. Oh, that's a good one, but that's not what I was thinking of. Evening meals. Don't know who said that. Dinner time. Those families that sit down together as a family have a statistically higher success rate with their children. Even though you think your children aren't listening and they're making comments and what have you, they're listening. So parents become more confident in their parenting and decision-making skills. Parents gain more knowledge of the child's development and learn how to use positive reinforcement. They have a better understanding of the teacher's job and school curriculum, so they're not as critical of the school environment typically. And when they're aware of what they're learning, they're more able to help. And the parents' perceptions of the school are improved. And they become, as a result, more active because they're more comfortable. So there's benefits to the children, and there's benefits to the parent and family. So as I discussed earlier, we go in and do a simplified 6-class curriculum, school wellness policy, advocacy. Then we go into a piece on nutrition education. Now, I'm not a teacher. I'm not credentialed. So we develop our curriculum from all of our friends and collaborators. So we are a relatively small agency. When I started, it was me and my parents. Then we added another program manager, and we now have 2 program managers, 3 program coordinators. So we're broken up into pods of 10 schools so that each school gets 2 site visits from a managerial type person to make sure the program implementation is operating correctly. And each school gets 1 parent education meeting per month. And then we bring the whole group together, sometimes all together. Now we kind of break it up because there's so many of them and they don't get to talk as much. But each parent volunteer coordinator that we hire gets a training each month on whatever the topic of nutrition education we're teaching that month, and they learn a new physical activity. And we base the physical activities on things you can do with little to no equipment, just an open space. And sometimes we'll teach something you can do in a small living room with a wall and a chair. So our nutrition education piece is focused on the MyPlate curriculum and label reading, as well as reducing sugar-sweetened beverages, which is, there's a program called Rethink Your Drink. These are all curriculum-based materials found on the website at the California Department of Public Health. But we've also made friends with the Orange County Department of Health, and they have an organization called NEOP, which stands for Nutrition Education, Obesity Prevention, which is kind of a tongue twister. They used to be called something else, I can't remember. They changed their name when some funding and objectives changed a few years ago. So we're friends with them, and they'll oftentimes come in and teach the class for us, which is great because they're all certified RDs, registered dietitians, and educational experts. So we get that just as because they like us and they want access to the parents, which is great for us. And then, so that's in the 6 classes, and when we do our monthly topics, we follow right now, but we might change this next year. We're kind of doing some research and some brainstorming. We follow the Harvest of the Month curriculum, which is also from the California Department of Education, and that's a curriculum that's really well-rounded. They pick a fresh harvest that's sometimes common and sometimes not. Like sometimes the lesson will be on how to use citrus effectively in your diet. And sometimes it'll be something that, is interesting to taste, but is easily available, affordable. So what we do is we share the curriculum, we share the handouts, and we do a recipe. So they're learning an actual recipe that's super easy and affordable to do at home. We want to take that to the next level and start doing actual grocery store tours and talking about financial stability. If you're on a WIC income, does everybody know what WIC is? Okay, if you're on a WIC income, it used to be called food stamps, and you're trying to feed a family of 4, 6, 8 people, and you're trying to be healthy, it's a balancing act. And oftentimes we find that why they're buying the unhealthy stuff is because it's easier. They've got a limited amount of money, and they're going to grab those packages and processed foods that are easy for them, that they can afford and use the most. So we're trying to, next year I just wrote 2 grants for funding to improve that model. Okay, so, and then we teach physical activity versus physical education. Oftentimes people think, well, they're getting their activity in PE. Well, right now, there's a whole thing going on in elementary schools where they were finding, I think Santa Ana, maybe it wasn't Santa Ana, I know Northern Cal got sued because schools are required to teach and provide 200 minutes of physical education every 10 days. So that's about 20 minutes a day. Now the difference there is this is supposed to be provided by a certified licensed educator. So our minutes don't count because we're just out there playing. So we're teaching parents, A, did you know that your child is supposed to receive 20 minutes a day? And do you know what that's supposed to look like? What they were finding is that teachers were going out in the playground saying, okay, everybody, go play, and counting that as their time. It needs to be instructional time. They need to learn something about body movement, about how to exercise in a healthy way, as well as structured games, the rules of volleyball, not just here's a volleyball, there's a net, have at it, but how do you play volleyball? So they were finding that those things weren't happening. I'm seeing a lot of change, and it's really, really exciting. And then we teach them physical activity. What is physical activity? It's getting up and moving any place, anywhere, anytime, with equipment or without equipment, but getting your heart rate going. So we're teaching them how to do that more effectively when their child is at home. And then playground management, as I discussed earlier. How do you go out on the playground and safely get 25 kids in a game where they're going to all be moving effectively? Okay. Oh, and the final session, our last half of the classes, we do a potluck, and we ask them specifically to bring an item to share with their new friends that is healthy. So they'll come in and we'll put all the items on the table, and we'll walk through what they brought. And not to criticize, but to give them a little tip on, you know, this flan is really great. Did you know that if you don't use sour cream or whole milk or, you know, however they made it, that you can reduce the calories and fat and make it a tasty, healthy meal. So we use that opportunity as well. Okay. So our program goals are to empower parents to be leaders in nutrition and physical activity, and to create healthy habits in the home and in the community, and to have healthy, active families. I talked about our monthly parent trainings, which are parent meetings basically. It's a very casual environment, and our objective is to teach them something about nutrition and something about physical activity. This is an example where we did, I think it was our quinoa, whole grain. Harvest of the month was whole grains. So we showed them different ways to find whole grains. Okay, now this was done by a parent, and it was so cute because this is where they really take it to the next level. We gave them the handouts and the curriculum, and she went on her own and printed out the little anatomy of a whole grain, cut it out and put that on, and then gave, you can see it's on a piece of cardboard. And I don't stress about that kind of stuff because I'm so happy that they do it on their own. And then went out and got samples of different ways to get whole grain in your diet. And then, and then that's just an example where they did a friendship salad. One of the shares was salads and greens, and different ways to get greens into your diet. So they did a friendship salad, and all the parents brought different items that they could put into the salad that were all representative of healthy items. So it's kind of a potluck recipe share meeting. Okay, so how do we know that, is there any questions so far? How am I doing on time? Okay, good. Okay, so how do we measure that we're effective, and why is it important to measure? We are right now about 50-50 in our funding. I get about 50% of our income from grant-funded things that I submit, and it's anywhere from private foundations like Pacific Life, the Aetna Foundation, Orange County United Way, to public funds. We were just part, as Mo mentioned earlier, of the OC Pitch, Partnership to Improve Community Health. That money was from the Center for Disease Control, And when you get funding from these different resources, there's different rules applied to it. The CDC was one of the hardest grants we ever dealt with, because you had to, you couldn't just take your $50,000 and spend it as you saw fit. You had to justify, what you were spending it on. You had to show that you got 3 different quotes, and it was pretty intensive, but well worth it. So one of the ways that we measure our outcomes, because that's very, very important to tell your funders what you're doing and the success and outcomes that you're having. So, and this is actually an example of a SoPlay observation report that we did at Thorpe Elementary, and Mo helped us on this. Has anyone ever heard of SoPlay? This is an observational tool that was recommended by the Center for Disease Control, and they did a webinar and taught us how to do it so that we lay people could do it on our own. And the formulas and all that are built into the data or the program that they gave us. And then Mo was nice enough to bring a team of students out to help us make sure we were doing it correctly. So we do it now on our own, and we'll run it by some experts to make sure that we didn't make any mistakes. But this was done at Thorpe Elementary School last spring. And what we do is we go on an intervention day versus a non-intervention day. So intervention obviously is when parents are present on the playground running recess. That's on Monday, Wednesday, Friday. Then we go on a non-intervention day, Tuesday or Thursday, when no parents are present, and we measure the difference in play. Well, we were so happy to see the outcomes, because on parent intervention days, there was a 41.3% decrease in sedentary activity, and a 45.2% increase in moderate activity, and a 42% increase in vigorous activity when Padres in Action was present. We were super happy. And as we've done these, we'll take a different school site, different conditions, a little bit colder versus warmer, to make sure that our observations aren't skewed in any way, and they come out pretty consistently. We engage about 30 to 50 parent volunteers. These are not the same people coming out every Monday, Wednesday, Friday, but within that school setting, it averages. And they'll have between 6 to 8 parents out there every day, which has a huge impact on the activities that you can offer each day. It averages about 500 volunteer occurrences each year for the individual school, and increases their level of play for 7,500 plus minutes each year from September through June. These are some photos of some of our parent groups. Like, they're leading a dance station. Right? We wear yellow vests so the kids know that we're out there. Here's a parent that was actually leading an obstacle course. They started at a warm-up station and then went on to do some sit-ups, and then went on to do a tunnel run and some other activities on the playground. This is some feedback we've gotten from our principals and vice principals. MAN started in 2015-16. They were one of our pitch schools, so they were given a grant. What we try to do with some of our schools is we'll offer them grant funding in year 1, sometimes year 2, depending, and after that, they have to pay fee for service. And we try to keep that cost low with other grant funding. So it's about $6,000 to renew the program for 1 year, which is, in comparison to other programs being offered in the public school setting, very, very affordable. So that's how we're sustaining ourselves. We have about 50% of our schools right now on the fee for service contract, and we have about 50%, which is some of our newer schools, that are still on grant funding. Each year when we're renewing those contracts, the first year we did it, was a nail biter. I was like, well, I might have a job in September and I might not. We had a 90% renewal rate, which just gave us further proof, and I shared around the world that the principals see it as a viable source or resource at their school sites. This was an article unprompted by us that the principal, Deanna Parks at Thorman in Tustin, wrote and submitted to their district newsletter. We were so happy. This is a typical day on a playground. That's King Elementary in Santa Ana.
We need to do that here in others.
Oops, that picture didn't come through for some reason. Or was that the video? Oh, that was the video. Okay. You can advance. Okay, so to recap, we're in 42 schools. We're serving 30,000 students currently, 3 times per week with active recess. We've trained over 1,080 parents into the 6-class structure who are helping us on a regular basis at these schools. And we've increased the healthy habits of parents in nutrition and physical activity. We proved that by a pre and post survey. I didn't put that up because it was getting a bit long. But we take a sampling of parents in September. We try to get parents who've never been involved before at the beginning of the year. And we ask them a bunch of questions regarding their behavior. This, I don't think Deli helped us on this one. We had one of our professors from Long Beach State help us on that. It's a how many minutes are you exercising each day on average? What's your consumption of fruit and vegetables? How many sugary beverages you drink each week? And then we survey them again in June to see the difference. And there is a substantial difference in there. Either they're telling us what we want to hear or they really are making these changes. And we see it. We see it by the snacks they're bringing. We see it by when we do events and things, what their children's behaviors are. Please connect with us. We have a Facebook, a Twitter, and an Instagram. And if you go on, Facebook is Kid Healthy. Twitter is @KidHealthy, one word, I believe, maybe 2. And Instagram is Kid Healthy, 1 word. You'll see we post a lot of videos and events and things like that. And there's a bunch of pictures of our Cooking Up Change event that was just held on Thursday. The winner from our competition now, which was La Habra High School, will go to Washington, D.C. on June 12th, and they will compete against 9 other teams from throughout the country. And the winner, and then while they're there in D.C., they get to meet with their local legislators. Last year, they met with their state senator and 2 council people from Orange County in general and from their actual district. And they get to talk about what they think about school food and how it can be improved. And then they invite all of the House representatives to a lunch where all the teams are in a room sampling the lunches that they created. It's a really amazing opportunity for the kids. And by the way, Orange County has won nationals 4 times. And we placed 2nd last year. No, last year we won. The year before we placed 2nd. So we're pretty proud of that.